Welcome to BW Healthcare World. We are hearing a lot of news about COVID and the new variant that is expected to hit the world. To understand if this is a reality or what we are facing is just a common cold and change of weather, or should we be really worried about COVID and its next variant, I have with me a very special guest, Dr. Sandeep Budhiraja. Dr. Budhiraja is a group medical director at Max Healthcare. In fact, he's been one of the founding members of Max Healthcare. Dr. Budhiraja specializes in internal medicine, immunology and rheumatology, gastroenterology and hepatology. Just the right person who can guide us on understanding if we are heading towards the new variant of COVID, and if it is, what do we need to do to be better prepared for ourselves and our loved ones. Welcome to BW Healthcare World, Dr. Sandeep Budhiraja. My first question to you is, what has changed in the past 2 years when it comes to COVID?
Oh, I think lots have changed. From everybody's, it was a first experience with a disease like COVID, whether that comes to people or the healthcare professionals. I think we have learned a lot during last 2.5 years from being a disease which was completely, we were not aware as to what virus it is, what category of virus, how it replicates, how it transmits between people, what are the possible treatments, how to prevent it, vaccinations. So from diagnosing it, characterizing the genomic sequence, world, rushing against time to create a vaccine. I think the clinical protocols, how they have changed from first month to end of first year to the second year have been something which has been a learning experience for all of us. We at the end of this phase, I would definitely say we now know much better as to how to treat these patients, how to prevent this disease. We know much more about the genetics of this virus. A lot of vaccine platforms, the mRNA vaccine platforms, which were there, but were mankind never had the courage to use those for actual therapeutic interventions or vaccinations. I think science has made a great progress. As healthcare professionals, we have learned the basics of infection control. I think something which world at a large had forgotten as to what pandemics mean and how to handle pandemics. The world was focusing more on lifestyle and communicable diseases. But we again came to that realization. Of course, in India, we always had a dual burden of infectious and non-infectious diseases, but Western world specifically had almost forgotten what epidemics and pandemics and infections are. So I think this has been a wake-up call for the entire world. That these diseases, the viruses and bacteria ultimately will be part of our life. We have to learn to coexist with certain infections and diseases and be always prepared and at our guard, not only at a local hospital community level, but I think at a national and a global level. That these epidemics and pandemics will keep coming in one form or the other, and the world has to be at their guard, prepared. Basic things like oxygen requirement and how to handle that surge in a hospital was something which was a completely people were taken completely unawares. So I think those have been huge learning experiences, basic infection control measures, and I think these experiences have been a relearning of what a century-old practices were. Of course, with the new science, with science adding to new modalities. So I think hopefully we'll be all at a global level be better prepared for future generations to handle such issues if they come, which I'm sure will keep coming off and on.
So, Dr. Budhiraja, we've been listening to a lot of news of this new variant which has come up in China and it is now spreading to the world. Now, which variant is mostly found globally, and is it the same variant that we find in India? Is it lethal? Is there something to be worrying about, or What about this new variant that we're listening of?
Okay, since I would say November of 2021, the variant which is there in the world is Omicron. Okay, and all the other names we are hearing about are all subvariants or of Omicron or lineages of Omicron. Okay, so we need to understand when COVID first started, it was the wild Wuhan strain of virus. Then, towards the end of 2020, we started hearing about new strains like Alpha variant. Then, of course, nobody in India would forget about the Delta variant, which happened in 2021 summer. And then, of course, November 21, Omicron. So, you need to understand that this Wuhan, Alpha, Delta, Omicron were the new variants, and each time a wave or an outbreak happened in country or world was because of a new variant emerging. And all these variants, when one variant came, a new variant came after about 4 or 5 months. So at most, one major variant could just establish itself for about 4 or 5 months. Here, what we are now seeing is Omicron establishing itself since November of 21. So it's been almost 13 months since a no new variant has emerged. All the lineages, which are all the new sub lineages are coming, are from the Omicron. So overall, it is the Omicron for last 13 months. And these sub variants have been emerging, which is natural course of any viral mutations. Now, the data says that the average number of mutations is about 26 annually. In the Asian subcontinent, it is almost 30, 31. So there are more frequent mutations in these Omicron variant, which are happening world over. If you want me to name the prominent ones as of now, XBB is one, BQ1 is another one, and BF7, which everybody is talking about. But essentially, you need to understand that these mutants or the sub variants of these Omicron essentially have some additional mutations to the original mutation which happened in Omicron. What this does is it gives a benefit to the virus that it increases its transmissibility. That means person to person spread is faster. Their incubation period is shorter. RO is the one person getting infection, how many it can cause infection to. So that number for the present BF7 is 10 to 18. That means one person getting infected can give this virus to 18 more people, and that's how it spreads. So it is definitely much faster in transmission as compared to the older mutants. It also has a phenomena of what we call as immune escape. That means the vaccinations which were originally made, the effectiveness of these present vaccines against these present mutant strains is much less. That means if you are fully vaccinated or if you have had disease or COVID infection in 2020 or 2021, you or any one of us is at risk of getting a fresh infection by these mutant strains. So we can get infected very easily. But fortunately, what is not happening is the virulence, the severity of disease is not increased. So they are not more deadlier or more severe than the deltas. Deltas was probably the most severe one. So they are more infectious, highly transmissible, less shorter incubation period, immune escape, so less effective against the vaccines. But because of all these things, we have been vaccinated, we have had previous infections. So our body now is more sort of prepared to handle these mutants now and in future so that the disease will not be severe. So what we are seeing over the last 1 year with this Omicron and other sub-lineages is that the number of hospitalizations and the death rate have been significantly less as what we saw in the first 2 years of the pandemic. Obviously, you may ask me why is the situation so worrisome in China? China, I think, is not something which we can't compare to what's happened in the rest of the world because of their zero COVID policy. Their vaccine efficacy has not been so good. The way they have not fully vaccinated their elderly population. So the population is what we call as naive. They have not had enough exposure, so they are non-immune or poorly immune against the virus. So for them, even this viral strain is behaving in a very different manner. But I don't think the rest of the world really needs to worry too much in terms of the names of these mutants or the strains or which variety. More or less, they are behaving in a similar fashion.
Dr. Budhiraja, this brings me to a very interesting fact that, people, I think, have become a little fearless of what COVID could do to you. And because of which they are, there is a lot of self diagnosis कि अगर ये हो गया है तो मान लो कि COVID हो गया है. Or if you, like you mentioned that, if you've had COVID earlier in 2020, it does not seem to protect you from the next COVID wave. Now, what are some of the symptoms that one must keep in mind to be able to diagnose that it could be COVID?
So although the mutants have changed over last 3 years, but the symptoms of the disease have not significantly changed. So the overall presentation of a person who comes down with COVID, irrespective of whatever subvariant he may have got infection with, fever, cough, cold, throat pain are the main symptoms, with body aches, headache. Some people may have a tummy upset, some stomach issues, abdominal pain. These are, in large, the common symptoms. Uh, what we are not seeing so often nowadays is loss of taste and loss of smell, which was being very significantly being reported with the original Wuhan strain. So that's happening much less often now. And obviously, there's a proportion of patients who will come down with this infections, but will be completely or largely asymptomatic. That means they will hardly have any symptoms, maybe just a little bit of body aches, myalgias, and that's about it. And the other end of the spectrum is a person can still come down with bad infections like pneumonias and multi-system conditions. So it all depends upon a lot of factors, including your presence of medical comorbidities. So if you have advanced diabetes, poorly controlled diabetes, cancers, or a person is on immunosuppressive drugs, so those are people or populations who are at higher risk of still developing a serious disease. Extremes of age, elderlies definitely remain more vulnerable population. So one needs to understand that although, as you have said, that people have become, fearless about the disease. So I don't want to create push a panic button here. I don't want to say that people should be worried about the disease, but yes, one needs to understand and adopt a rational, guarded optimism. Okay, you need to understand that yes, if you are vaccinated, if you have had disease in past, if you don't have these comorbidities, you are not extremely old, you are not in that vulnerable population, the chances that if you get an infection, your disease will be mild are very high. But at the same end, we are part of a family, we are part of a community, we are part of a country, and it is we who spread the infection to more vulnerable population. So the idea is not that okay, infection हो गया तो क्या कुछ नहीं होगा. No, the infection is the logic should be अगर मुझे infection हो गया, I might still spread this infection to other vulnerable population. So I think the idea remains the same as what we have been speaking for 3 years. It is first self protection, and second, it is protection for the others who may not be as lucky as you might be. So hence, prevention is still the best way of defending yourself and your loved ones around you. And that's the reason why we say that you be cautious about the news which you hear. Don't panic, but at the same time, apply your common sense. So if you see that the numbers, and obviously the government would do all the right steps, but if an advisory comes that, look, now you please restart using mask, or you start avoid going to you don't go to big crowdings, or partying is to be curtailed. So those advisories, as and when they come, will have and do have a logic. So the request is please follow them. But obviously we know that now things are very, very different in terms of COVID from what it was 3 years back. So that's a good a hope, a positive thing. But please do not use that to say that kuch nahi hoga, and it's not, it's just a simple flu virus. It's not like that. It does still cause and can cause a lot of problems. And in fact, not to forget that there's something called long COVID syndrome or post COVID, where people who have very mild COVID can still have long term consequences of the virus in terms of mental fogging, lack of concentration, fatigue, weakness, hair loss. So those don't seem like very important symptoms when you get an infection, but ultimately for several weeks and months, people are suffering from many such symptoms. So I think it is best as long as one can avoid getting that infection.
So, Dr. Budhiraja, you just mentioned that the common symptoms are about cough, cold, and these kind of things, which are very similar to a flu or a common cold. And we are at that part of the year where we are experiencing change of weather, etc. And people usually get these common cold, flu, etc. How does one differentiate? Do you recommend or suggest that if you have a common cold or you are experiencing these symptoms, you must go in for a COVID test, or people just do the care at home?
Yeah, so that's actually a very, very important and a very valid question at this point, because presently world over there's a outbreak of flu which is going on in India also, and much more so in Europe and US. Practically every household is coming down with flu. Now, flu outbreaks world over are very common and have been always been there. Okay, there are years when it is more, there are years when it is less. Cold weather, onset of winters in Delhi, especially in North India, post monsoon. These are the months when the flu, we call these as flu seasons. Now, and when you have multiple viruses going on, which cause upper respiratory symptoms, so these could be flu virus, we call it as influenza. And the strains of influenza A, which we are presently finding coming out more, are they're labeled as H and N. So H3N2, H3N1, H1N1. H1N1 is what we also call known as is also commonly known as swine flu. There was a pandemic of swine flu many years back. So this H3N2, H1N1 are the influenza viruses which are causing present flu. At the same time, one must understand that COVID cases have always been there in the last several months, although we see that statistics shows that the numbers are going down, but there have been many cases where we have tested and the patients have turned out to be COVID positive. So in terms of symptoms, it is extremely difficult just by taking history from the patient and asking what symptoms you have. It's very difficult to differentiate the seasonal influenza from COVID. Uh, Typically in flu, you will get more of sinus congestion, more of nose congestion, more of nasal discharge. Whereas in COVID, you'll get more of throat pain, cough, body aches. But presently we are not seeing that differentiation. Normally, we used to say that flu is a condition which will last for 3 to 5 days and then abate on its own. You don't really need to do anything. Just rest at home, drink a lot of water, don't physically overexert yourself. Those principles of treatment still remain the same. Okay, but nowadays we are seeing with these present flu strains, a lot of people are complaining of very high grade fever. Sometimes the symptoms are lasting for as long as 7 days or even longer, and that post flu symptoms are also seemingly exaggerated now. So the evolution of symptoms with these viruses also keeps changing and getting modified. But to answer your question, very difficult to differentiate. So now comes to the question that should everybody be tested? If I've come down with a simple cough and cold or low grade fever, what do I do? See, the best thing you should do is, at least the principle is that I don't want to give this infection to others, whether that is flu or whether that is COVID. So first thing I should do is isolate myself. So if I'm working in an office, working in a hospital as a doctor, I should take off. I should rest for a few days. Resting will also help me heal faster, and it will prevent me spreading infections to the others. So in a house, in a good ventilated room, I should just isolate myself, maybe for 3 days. In COVID, we normally say 5 days of isolation is required from the day of onset of symptoms. Uh, at least use a mask. Tell your other family members and close people around you to wear mask. Now, the question of now doing COVID testing, when the COVID outbreak was, the numbers were high, large in country, everybody was being tested for COVID. Okay. Then last year, we started having these home kits, the rapid antigen testing kits. So people started using and started doing self-testing. Though both those, the RT-PCR and the rapid antigen test, both are good tests and give a quite reasonably accurate reports. Now, what has happened is, because the people now feel that the disease severity is down and, even COVID is like a flu, why should I test it? Well, what that is resulting in, or what that can result in, is rapid spread of the infection. So I think the principle of diagnosing whether you have COVID or not COVID and isolating for a defined period of time still is valid and very, very important. So if presently a person is coming down with symptoms of fever and cough and cold, I would strongly suggest that if nothing else, but a home antigen COVID testing should be done. If it is negative, it is not 100% sure that you are negative because the test is not 100% accurate, but at least you are reassured that you are not going to spread COVID to the community. Keep yourself indoors for a day or two, get your symptoms in order, become afebrile, that is, the fever settles down, and then you can join back. If you suddenly see this clustering, suddenly a lot of people have together become unwell, it is still it is again advisable that you do these testing. And of course, government has come up with recommendations that all international travelers coming from certain countries have to produce a negative RT-PCR. There is some random 2% testing for international travels. Why these advices are put in place is because of the international reporting of the disease trends. So if the disease trends show that there's been an outbreak from a particular country, it clearly makes a scientific logic to test travelers coming from that country, because we don't want them to carry the infection in our country and spread it around. So containment policies, timely testing, uh, reviewing these policies, when to test and how much to test, will be a very, very dynamic and ongoing process. And I think we must respect and accept the advisories which come from either the local state government or the union government, and act accordingly. A word here about genomic surveillance, genomic testing. I think that's extremely critical, because that's the only way by which we can know which is the locally circulating mutant in our country. If a new mutant virus gets imported from a traveler, that can get picked up. So I think that genomic surveillance world over had come down because the global numbers had come down. But now most of the countries have reactivated their uh, pace with which the genomic surveillance needs to be done. So that's been put up again in our country also. So I think all measures in the right direction.
Uh, Sir, you mentioned that we should still continue to do the RT-PCR test or the antigen test at home to be reassured that we don't carry that virus, and we don't carry that virus that could spread to others. Now, the testing kits that are available are still the same as what we were experiencing or what we saw a year ago, and maybe more than that. Are these kits still applicable for the new variants as well?
Yes, they are applicable. Although if there's a major change in the genetic makeup of the virus, then the kit manufacturers will have to change it. But then that will be a completely new COVID altogether. So hopefully we have not seen that. But the present mutants, the level of mutations which they are undergoing, we can with reasonable confidence say that the present existing diagnostic methodologies, whether that's RT-PCR or the rapid antigen tests, are still working. Never ever were we saying that they are 100% sensitive and specific. But yes, they still have their role, they still have their value, they are still validated against the present mutants also. So please use them. As and when we find that the kits need to be modified, that will automatically be done. But the ones available in market today are working as of now.
Dr. Budhiraja, another thing that comes to my mind is you mentioned that the vaccines were developed for the original variant, and they may not be as effective for the new variant. Now, what does that mean? That do we have to wait for a new kind of a vaccine to be created, or should we even consider getting a booster dose, or should we just ignore that because if it is not going to be effective, what should people do?
Okay. I'll answer the latter part of your question first about the schedule of vaccinations in our country. So the clear guidelines are the two primary doses followed by one precautionary dose, or what is also being called the third dose or the booster dose. So when we, for Indian purpose, say booster dose or additional dose or precautionary dose, it means the third dose. Presently, there is no recommendation for India to take more than 3 shots of COVID vaccine. So a fourth or fifth booster has been implemented in certain countries across the world, but not in India. And the experience, even in those countries where they have given the fourth and fifth dose, has not been any different from what we are seeing in India. They are still getting infections. And in fact, there are increasingly reports which are showing that fourth and fifth dose, the immunity which gets generated is much shorter lasting than after 3 doses. So I don't think we need to talk about anything more than 3 doses. But the statistics also show that in India, only 27% population has had the third dose. So I think it is high time that we wake up again and tell people who, the 67% people who are eligible people who have not yet taken their third or the precautionary dose, to go forward and take that. Ideal recommendation was that it should be taken after 6 months of the second dose. But if this people have missed that period, still it is worthwhile taking the third or the precautionary dose. Now, the government of India has recently launched the nasal vaccine. Obviously, the real results would come once the larger masses and the population starts using it. But there's a very interesting phenomena with this nasal vaccine, at least theoretically, is that since it is given in nose, so it creates a local mucosal immunity in your nose and upper airways. So this is one potential vaccine which has the ability, theoretical ability, to prevent the virus from entering into your body inside the nose beyond the upper airways. So theoretically, it can actually prevent a person from even getting infected, which other vaccines can't. Obviously, once we start using it, we'll have a better experience with it. And obviously, it's without a prick, so it's easier to administer. Logistics of transport for Indian as country, for India as a country, are much easier. So I think that is worth considering, and that can be given to whether a person has had a Covishield or Covaxin. So there is a what we call as a heterologous immunity boosting, which may be better than using the same vaccine. So now, whether these vaccines will be effective against these present mutants was the other thing you asked me, and should we be changing these vaccines? Vaccine production, and especially when we talk about flu vaccines, if you know that every year a new flu vaccine comes up, and that flu vaccine is dependent upon the prevalent strains of flu virus in that hemisphere or that part of the world, globe. And the original flu vaccine had one strain, then two strains, then trivalent is three strains. The present flu vaccines which are used are called quadrivalent. That means they have four strains. So they protect against influenza A, B, and also the swine flu. Now, the future is, I can tell you, is that the same flu vaccine will also contain a COVID vaccine. That ultimately will happen. So you will take one shot annually, which will have all these protection against viruses. Presently, what has happened in the Western world is that the mRNA vaccine, which was against the original Wuhan strain, now they have made it a bivalent vaccine. That means they have also added against against the Omicron strain. So now they are routinely administering this bivalent mRNA vaccine, the Pfizer and the BioNTech, which will cover for both the strains. In India, we do not have that. But I think going forward, ultimately, this will happen. The manufacturers will shortly, or in coming several months, modify the existing vaccines in India to ensure that there is a better protection against Omicron also. And God forbid, if some new major mutant comes up in future, that also will then have to be integrated. So vaccines will keep getting modified. We call this as first generation vaccines, and the second generation vaccines and generation vaccines will keep coming in. But the basic crux of any vaccine, whether that's an old vaccine or a new vaccine, is that it will give you a huge protection against you coming down with a major severe disease. It will, to a large extent, prevent hospitalization, prevent mortality. At the end of it, even if you get infected, hopefully the disease will be mild. And that's ultimately what is most important. And that's why we say that present vaccines still hold a huge relevance. They still form a very, very important preventive measure. And we must encourage everyone, especially the most vulnerable people, to follow the recommendations or the guidelines of the country they are staying in.
Dr. Budhiraja, since you mentioned the most vulnerable, you had mentioned earlier that it is the people with the extremity of age, either the very old or the really young ones. Now, the challenge with the young ones are people, the kids below 10 years of age are not being vaccinated at all. So, what has something changed? Because across the globe, we've seen children below 10 years of age also being vaccinated. Should we be going ahead with that?
So, the reason for vaccinating the two extremes of age are very different. When we talk about elderly, they are vulnerable because they can get a more severe disease. Okay, they will have a higher mortality. Now, in order to reduce the risk of mortality and severity, elderlies need to be vaccinated. Children fortunately do not get a severe disease. Okay, unless until it's a premature child or a child already has some asthma or type 1 diabetes or some immunosuppressive disease, those children are as vulnerable as adults. But the problem with children is if they are left unvaccinated, they are the ones who carry the infection home from preschool or nursery or schools, and they themselves will probably in all likelihood get a mild disease, but they may transmit that infection to the elderly members of their family. So to break that cycle of transmission, it is important to vaccinate your children. Elderly vaccination is important to reduce the risk of severe disease. So in order to have the country or world as a safe place to live in, any set of population which is left unvaccinated is a risk to the world. You can't say, okay, let's vaccinate. Asia is a manufacturer of vaccines, so they have accessibility. West has money, so they can procure it. Africans, they don't manufacture, they don't have money, so leave them unvaccinated. Any country, any continent, any community left unvaccinated, or any part of the population left unvaccinated can be a reason why the next wave or next pandemic can happen. And that's why the reason is that ultimately your national vaccination programs, immunization programs have to cover the entire spectrum of population. Obviously, the priorities differ. So when you start vaccination, you start prioritizing the most vulnerable population, that's the elderly. Then come to the younger people with comorbidities. Then come to younger people with no comorbidities, and you come to the children. China, unfortunately, has not adequately vaccinated their elderly population. Now, in India, the elderly population is 6% of the population. In China, there's 16, 17% of the population is elderly. So if you don't vaccinate them, they will die. They will have higher mortality, and that's what we are seeing them. So multiple factors have to be taken in context to how a country adopts its vaccination policy.
Sir, I have a question which is from a very layman perspective. Like you said that we need to vaccinate the children because even if they have the immunity, but they are the carriers of the virus. Now, when you vaccinate someone, do they not get the virus, or they get the virus but it does not affect them, but they still could be carrying the virus for the people? That's a doubt in my mind.
Yeah, so you are absolutely right. Vaccination does not guarantee that you will not get infected. And that's the reason why we say, even if you are vaccinated, you will still have to follow the precautionary of wearing mask, hand hygiene, and maintaining distancing. But that should not be a logic not to vaccinate. Okay, so vaccination, you are still at risk of getting the disease, but the risk of unvaccinated getting infection is much higher. So you are reducing the risk, but you are not making that risk zero. But definitely, if you come down with infection, you are reducing the severity of the disease. So vaccination has all advantages. Obviously, we still have not till date been able to produce a vaccine which says that, look, you are vaccinated, so just go around the world without any this thing. You are completely risk-free from getting infection. No, that is not possible. But yes, I'm sure future generation vaccines can even guarantee you that.
Dr. Budhiraja, now from the hospital perspective, you are practicing in a hospital which is a large healthcare chain. Are we prepared for any next wave that could happen?
Yes, we are. And in fact, you would have read the government advisories just about last week. The Union Health Ministry sent a circular to all the state health ministries that all the hospitals which were participating in COVID have to be prepared. In fact, mock drills just happened a few days back. So we have now earmarked the designated beds which we were supposed to for COVID, ensuring that those beds have oxygen supply. There are designated ICU beds which are available. Most of the bigger hospitals now have PSA, the oxygen producing units. So the staff retraining, mock drills internally, patient education leaflets, standees, ensuring that the diagnostic test supply is available, the labs processes are in order, flu clinics, places where people with suspected infections can be handled separately. monitoring of thermal monitoring at entrances, all those, and reinforcing the masking. So many of these were in place. Many of these had been taken away, or sort of stopped because the COVID numbers were extremely low. So many of these things have been put in place so that we are prepared. I think that's something which we must do at this stage. Be prepared. Now, that be prepared doesn't mean an alarm bell that thing is actually going to happen. In all likelihood, my personal feeling is we are not going to see a situation anywhere near close to what's happening in China. The numbers of infection may increase. That would anyway happen in winters. In any flu virus, any respiratory virus, coronavirus, the numbers will be higher in winters. Okay, so the numbers will increase, but I don't think that will reciprocate into major overwhelming situation in hospitals. People, the vaccination status, the antibody, the seroprevalence has shown that almost 70%, 68% of Indian population has antibodies against the disease. So I don't think we will have a major situation here. But yes, I think be prepared, be on your guards, follow the policies and recommendation and guidelines as per the state government and the union government, and I think we should be safe.
My last question to you, Dr. Budhiraja, before I let you go, is what are some of the precautions that you recommend for people to ensure that they can prevent themselves from getting infected?
So, as we've already been discussing, I think make sure that you have been fully vaccinated. So, the 3 doses need to be taken. Secondly, now I would not raise the alert bell and panic and say everybody starts wearing masks all the time. But when you are going out in crowded places, it will be advisable to wear masks. Okay. Next is, again, it's a New Year's time. It was Christmas recently, so I can understand a lot of partying is happening and will be happening. But play safe, be safe. Do not be in very big crowd, which is completely unaerated rooms and closed settings. Even if you have to party, do that, but do that sensibly in more open, well aerated, well ventilated rooms. More importantly, people who are themselves not feeling well are the ones who need to be most cautious of staying indoors. So they should, if I am come down with cough, cold, and flu, and I am going for a New Year party, it will be very, very insensitive and wrong of me to be doing that. So I should rather let my friends enjoy and I stay at home so that I don't pass on the infection and whatever infection that might be. So it is simple, common sense things which will go a long way in ensuring that we and our families and our population remains safe.
Dr. Budhiraja, thank you so much for talking to us. I think it is extremely important that we understand that prevention is not just for ourselves, but for people around us. So we need to start behaving responsibly so that we do not create a challenge for the society that we are a part of. Dr. Budhiraja, thank you so much for joining us on BW Healthcare World. We really value your time and your information that you've shared for the people.
Thank you. Thank you.